Good afternoon to you all from Dublin. Firstly, I'd like to say thank you to Dame Yvonne Moores, Professor Greta Westwood CBE and the wonderful F&F team for the invitation to join you here for the annual conference. Celebrating your success as scholars through the presentation of certificates is so important. I'm so sorry that I can't be with you in person, but I do want to say a special hello to the wonderful scholars and mentors. This is your day and a fantastic opportunity to celebrate you and your achievements and recognise the contribution you have all made through the support of the Florence Nightingale Foundation. As an immensely proud F&F scholar myself, I am truly aware of the huge developmental platform and opportunities the Florence Nightingale Foundation creates for us as nursing and midwifery leaders. Our challenge, and my challenge to you as scholars, is to harness each and every one of those opportunities so we can be curious, impactful and relentless in our commitment to our patients and in leading our professions. As leaders, the road ahead is anything but easy. However, with the skills and network you have developed as scholars, I'd say you're well prepared for it. Looking forward, we will be caring for people with new complexities, in new environments, and in a diverse and digitally enabled world. We will always be challenged, but this is part of our leadership roles. But as nurses and midwives, we must continue to use our values of care, compassion, and commitment as a compass to navigate this difficult future. Using these values, along with our unique knowledge as nurses and midwives, through our proximity to patients, places us in a strong position of influence. The Foundation has supported us to understand ourselves better as leaders and to understand the importance of challenging ourselves so very often as leaders. I know I use my RADA skills more and more to increase my personal presence and impact on increasingly challenging situations. Harness this. As scholars, we should not underestimate the sphere of our collective influence through our networks. In fact, in Ireland, we have a growing number of F&F scholars. My colleague Marie Kilduff, Director of our National Clinical Leadership Centre, is there with you today as a new scholar and has been instrumental in developing a network of our own F&F leadership scholars in Ireland to be central supporting the progressing local and global strategic priorities. We're lucky to have leaders and scholars like you. Your journey and your achievements to date must be commended, particularly in such challenging times. And as the longest scholar ever, I was lucky to complete my programme over 3 groups, including many of you there today. It is also important, however, to look after each other, share the load and create safe spaces. Stay in touch. I'm so pleased that the F&F takes the 5-country approach and is now taking a global approach, further strengthening our connections. Congratulations to you all again on your achievements, and I look forward to collaborating with you in the future. You are all inspiring and I can't wait to see where it will take you. There are definitely many future CNOs among you.
Hello, my name's Alex McMahon. I'm the Chief Nursing Officer in Scotland. This is the second year that I've been asked to say a few words. Last year, however, I was in the process of coming into this role on an interim basis, but I was fortunate to be appointed substantively on the 1st of January of this year. So I'm both delighted and feel great privilege in being the Chief Nursing Officer in Scotland. But I wanted to congratulate all of you in undertaking the programme that you have done and in graduating from that programme. You are amongst the many nurse leaders for the future. It's a challenging, but at the same time, very rewarding, I think, future. How you will shape that, I think, will be hugely important. And I guess it falls to me and other Chief Nursing Officers across the UK to try and create some of the conditions that you and your colleagues will work within and to move that agenda forward on our behalf and indeed with us and others. Certainly within the Scottish context, there is much that we are trying to do in relation to providing longer term sustainable health and social care services. It's probably fair to say that there are workforce challenges not just in social care, but equally within health as well. From my perspective, we are looking at that through a lens of not just nursing and midwifery, but also through allied healthcare professionals and health scientists as well. We recognise that there is much to do in terms of how we train our students within our undergraduate programmes, and we are looking at how we set our student nurse and midwife intake numbers, and indeed whether or not we should have more than one intake per year. At the same time, within the allied healthcare professionals agenda, we are looking at how we might increase access routes into some of those professions, and whether or not we should actually set numbers in terms of intake numbers for some of those disciplines as well. And we are about to embark on a piece of work around the role that our health scientists play, and there are over 50 of those professionals within our system, and what can they do to support the services going forward. But in relation to nursing more specifically, I think the opportunity to look at access programmes, to look at apprenticeship programmes, to look at the way in which people can move through the grades, particularly bands 2 to 4, and then from 4 into 5 and 5 upwards are really important. Creating the conditions that would support people to progress will be hugely important, but also to be able to provide those educational packages of support as well. So that's why we are doing a lot of work in Scotland, particularly around band 4, but equally, as I've said, looking at how we set the student nurse intake numbers and whether or not we should have more than one intake per year as well. Equally, at the other end, we are looking at the transforming roles agenda and how we continue to look to see where we can develop new roles that nurses and others can undertake, and that they undertake them meaningfully in terms of the contribution that they would wish to make. Whilst at the same time looking at the research agenda and how we work with the academic sector to ensure that we are commissioning the service research that we need, that we're creating opportunities for nurses and others to undertake research, and that research in itself is not seen as an add-on or something that by exception we would expect nurses to undertake. But how do we create the conditions in terms of equity and parity like we have within medicine for nursing research to be more fully supported? And that's something that I'm committed to doing during the course of certainly this year and indeed into next year as well. Because that research and that research community should help to influence how we in government, certainly in Scotland, inform policy and give advice to ministers. So although I think that, this winter and indeed going into next year will provide its challenges, equally I'm sure there are many opportunities, and we need to work collectively to ensure that we do everything we can to provide the safest possible care to patients and indeed to our staff too. And that's why this year we're progressing the implementation of our Safe and Effective Staffing Bill that was passed in 2019 but paused because of the pandemic. And that framework will provide us a way into ensuring that across every territorial board in Scotland we're providing a level of consistency and that we can measure pressure ulcers and falls and staff absences, for example, on a like-for-like basis. So there are many positives, I think, that we need to look forward to. And I hope that you, with your qualification and your renewed vigour and interest in all things leadership, will work with us, not just in the Scottish context, but the UK context to drive forward the agenda and the improvements and the sustainability that we need going forward. Best wishes, and I hope you have a good day.
Good afternoon. I'm Maria McElgorm, Chief Nursing Officer for Northern Ireland. I'm delighted to have the opportunity to contribute to this conference, and I am sorry it has not been possible to join you in person today. Thank you to Greta as Chief Executive of the Florence Nightingale Foundation for the kind invite to join you all today, and to celebrate with our midwifery and nursing leaders from across the UK and Ireland. I have no doubt that you will be inspired by the exciting programme that is being delivered by a range of international nursing and midwifery experts. Whilst today is very much a celebration, we are mindful that the effects of COVID-19 pandemic are still being felt across the health and social care systems. I'm very proud, but not surprised, how midwives and nurses rose to the challenge. It took great skill and professionalism and no small amount of compassion to continue to support patients, families, colleagues and students through such uncharted waters. You, as midwives and nurses, have led the way in swiftly changing practice, making key decisions at speed. You are adaptable, responsive, innovative, and above all, remain kind and compassionate in the toughest of times. We are incredibly fortunate to have world-class nurses and midwives within our ranks. The scholars receiving their certificates today are the perfect example of why we should be proud of our nurses and midwives. Florence Nightingale, with her steadfast beliefs and values, cared passionately for those that she looked after and those she led. Florence was a pioneer in statistics, and we as midwives and nurses must irrefutably follow her example, using data and evidence to inform our practice. Safe and effective evidence-based care is our collective priority. As leaders, you are aware of the demands and the privileges of leadership. I feel very fortunate to be leading such devoted, talented professionals, and to be in a position where I can influence the leadership opportunities afforded to nurses and midwives in Northern Ireland. The pandemic has provided further evidence that nurses and midwives are the backbone of our healthcare system and one of the most trusted groups in our society. We strive to promote positive outcomes and experiences, supporting and empowering service users as we provide care throughout their lives. The leadership programs led by the Foundation are a once-in-a-lifetime opportunity. The skills you have gained will facilitate you to become key influencers as we rebuild our services post-pandemic. They will give you the confidence to contribute to the development of policy, not just locally, but nationally and globally. These opportunities will equip you to better develop yourselves, the teams you work with, and your wider organisations. So we ask that you embrace these experiences and help each other to lead by example, lead compassionately, and lead collectively. Leadership across the midwifery and nursing professions is critical to ensuring that our professions are valued and enabled to achieve their full potential to positively impact the survival, health and well-being of citizens across the globe. As I conclude, I would like to reiterate my thanks to Greta, Gemma and the team. They were pivotal to the success of this amazing journey, which you as scholars have had the privilege to experience. I want to personally give my warmest congratulations to all of you as scholars on your special day. Thank you for making a critically important contribution to the quality and safety of midwifery and nursing care. Care that our health and social care system is renowned for, and for raising this bar during what has been extremely arduous times for everyone. I hope that through this unique experience, you have not only grown as leaders for the future, but that you have gained skills and knowledge to support others on their leadership journey. I look forward to working with you all in the future. Congratulations, and I hope you have a wonderful day.